So this is known as gallows traction. Okay, gallows traction, it looks like gallows. You put a baby like this. You cannot keep a 3 or 4-year-old baby like this. It is impossible to keep them in a bed. Maybe less than 2, because third year negativism starts. If you ask the baby not to do, she will do. He will do. So less than 2 years you can keep them at least for one maybe for 2 weeks you keep and fracture unites. So less than 2-year-old child, the fracture shaft of femur is treated by gallows traction, whereas in adult it is treated by intramedullary nailing. Okay, and for unknown reason, though we don't normally practice the gallows traction, it has been asked in umpteen number of exams every time gallows traction, gallows traction. You should know the indications for gallows traction. Dynamic screw is applied for intertrochanteric fracture. Shaft of femur in children less than 2 years treated by gallows traction. They keep asking, gallows traction is useful in treating. They keep in all exams, even at last year, NEET, every exam they keep asking. It is for femoral shaft fracture, particularly for children less than 2 years. Then we are coming to see patella. Patella, it is the largest sesamoid bone, and patella there are two ways the patella can be fractured. One, direct injury, other is indirect injury. If you go directly hit somewhere, the fracture happens, the patella bursts, so comminuted fracture. Or you walk normally, unexpectedly when you contract the quadriceps all of a sudden during walking, because the quadriceps contraction is much powerful, when you contract and the patella gives way, it breaks, transverse fracture. There are two possibilities. The transverse fracture is because of indirect force suddenly by violent or strong contraction by the quadriceps muscle, and direct trauma, some heavy object fall on your knee, or you go hit somewhere, or your dashboard you injure, or when you sleep something fall on the patella. So any injury directly to the patella will break it in a comminuted manner, and that is comminuted fracture. So transverse fracture happens by indirect force, and comminuted fracture happens by direct force. And see this quadriceps, when it contract, it just breaks like this. Okay, see like this. So indirect force will produce transverse fracture of patella. See, this is undisplaced fracture, transverse fracture, and this is vertical fracture. This is comminuted fracture. The comminuted fracture is otherwise known as stellate fracture. Stellate, because of the shape of the fracture, it is known as stellate fracture. So what is the treatment? We know patella fracture can be managed two ways. If the fracture is undisplaced, what POP will you apply? Cylinder cast. If the fracture is displaced to transverse fracture, figure of 8. If the fracture is comminuted, if the fracture is, see, this is transverse fracture, you can apply figure of 8 tension band. If the fracture is comminuted this direction, that direction, and all directions, you cannot hold them like that. So what you do, you take a wire and encircle the wire all around. You take a wire, encircle, okay. So circlage wiring or encirclage. Patelectomy is the outdated method. We don't do patelectomy. Some of the textbooks says patelectomy. No, patelectomy, it was pre-replacement era. If you develop osteoarthritis because of the malunited patella fracture, we can go for total knee replacement surgery. So patelectomy we don't do. So comminuted fracture, the treatment is encirclage wiring. Sometimes we can think of partial patelectomy. Theoretically you can do total patelectomy, but that is not practiced as of now. So transverse fracture TT, transverse fracture tension band, and comminuted fracture CC, circlage wiring, comminuted fracture. You understand? Classical example of muscular violence, a muscle contraction producing fracture, patella. Tube cast is applied around, you know this answer. Displaced transverse patella fracture. Treatment is tension band wire. Undisplaced you can go for, you don't get carried away by patella tension band cost. It is nothing to do with that. We are moving to ankle and foot. This is ankle joint. Ankle joint is nothing but tibia, talar. So tibia talar joint, and you will have a joint between fibula and tibia, and this is medial malleolus, lateral malleolus. This is talar, this is calcaneum, this joint is talocalcaneal, or the joint below the talus is subtalar. This is talocalcaneal or subtalar joint, and this we will see later. Fine. So the ankle fractures are two possibilities. One, the medial and lateral malleolus can be fractured. That is by malleolar fracture, otherwise known as Pott's fracture. Bimalleolar fracture is otherwise known as Pott's fracture. Sometimes the posterior aspect of the tibia may be fractured, and that is known as posterior malleolus. When you have a medial lateral malleolus fracture, in addition to posterior malleolus fracture, it is known as trimalleolar fracture. Trimalleolar fracture is otherwise known as cotton fracture. The most common method of ankle injury is by supination external rotation force, SER. That is the most common method of mode of injury. So that will produce usually trimalleolar fracture. So when you come across trimalleolar fracture, the force is evident. It is SER, supination external rotation force. You understand? Fine. So there is another fracture. The distal tibial fracture, which is going into the joint, intra-articular distal tibial fracture. So that goes with the name pilon or pylon. Okay, there are three named fracture around the ankle joint. One is bimalleolar Pott fracture, trimalleolar or cotton fracture, or pylon fracture, that is intra-articular distal tibial fracture. You understand? Okay, fine. Pylon fracture is intra-articular fracture of the distal tibia. Trimalleolar fracture is classified under SER, supination external rotation force. And we are moving on to ankle and foot. This is, I told you, this is talus, this is calcaneum, this is talocalcaneal or subtalar joint, and you will have a mid-tarsal bones, and this is metatarsal bones. The joint between the tarsal and metatarsal bone is known as tarso-metatarsal joint or Lisfranc joint. This is Lisfranc joint. This is Lisfranc joint. Tarso-metatarsal. All these are tarsal bones. Okay, talus, calcaneum, and the cuboid, navicular, cuneiform, all are tarsal bones. So the bigger two tarsal bones, talus and calcaneum, form the hind foot. Other tarsal bones form midfoot. So this is joint between the tarsal bones, joint among the tarsal bones. So that is known as mid-tarsal joint, because this is mid-tarsal joint, or otherwise known as Chopard joint. So any amputation at this level is Chopard amputation. If you amputate at this level, it is Chopard amputation. Any amputation at this level, Lisfranc amputation. Any injury at this level, Lisfranc injury. You understand? Tarso-metatarsal is Lisfranc joint, and mid-tarsal is Chopard joint. Yeah, I just told you, na. This is hind foot, talus and calcaneum, and these other bones, midfoot, and this is forefoot. The joint between the forefoot and midfoot is Lisfranc, a tarso-metatarsal, and this is mid-tarsal or Chopard joint. Okay, I just told you the same thing. Similar. Okay, talus. This is talus. It does not have a much muscular attachment. So the blood supply is more of a precarious nature. So it only has a capsular ligament attachment. So that is one we have seen in the early section, that talus is known for non-union. Remember, 4 bones: femur, neck of femur, talus, scaphoid, and lateral femoral condyle. 4 important bones which are going for non-union. So this talus, what happens when you fall from height? Aviation, you know the meaning of aviation, aviator, aviation technology, yeah, flying. The people who are under training, I mean the aeronautical engineering students, sometimes they usually fly low level only, some meters, in hundred of meters. When they suddenly fall, I mean some accident, when they fall, it is a fall from height, but not as too much. It is not that that Malaysian aircraft which disappeared in no thin air. It is not like that. It is something visible. When they fall, when you fall on the floor, you keep the foot on a dorsiflexion. If you keep the foot on the dorsiflexion like that, the the that is the receipt for talus fracture. So see, when you fall from height with the ankle dorsiflexion, this is anterior lip of the tibia and this is posterior lip. The anterior lip will act as a pivot, will hit at the neck of talus. This is head of talus, neck of talus and body of talus. Okay, it will exactly hit at the neck of talus and that will break and produce like this. So dorsiflexed ankle, when you fall from height, it breaks at the neck of talus and that is why it is known as aviator fracture, and it is fall from height with the ankle dorsiflexed position. Complication, again the blood supply is coming from head of talus, neck of talus to body of talus. So any injury, cutting injury, this the head will escape and the body will go for AVN. So the body of talus will go for avascular necrosis, and this fracture is again known for non-union, and the head of femur, I mean head of talus will escape from all sort of a avascular necrosis. You understand? Okay, the complications are AVN of body of talus and non-union at the fracture site, and osteoarthritis because the ankle joint is affected. The patient may develop osteoarthritis of ankle joint because of the less blood supply and the less soft tissue coverage. You can have a wound infections. Aviator fracture involves talus. Or neck of talus, not talus, neck of talus. Most commonly injured tarsal bone is, I just want to tell you, most common injured is calcaneum. Most commonly injured tarsal bone is calcaneum. Most commonly injured carpal bone is scaphoid. The question has been placed just ahead. I think there are some slides missing. What has happened? Some calcaneal fractures. Some slides are missing. Sorry. Yeah, it is. Yeah, so there are some fault. There are some fault. Yeah, AVN. AVN is common in all except this question. Common cause of fracture of the neck of talus is fall from height with ankle dorsiflexion. Then only you can hit the neck of talus and produce neck of talus fracture. You understand this? Very good. And AVN is common in all except patella. So there are a lot of confusions. See, neck of femur fracture, where do you get AVN? Head of femur. The cause of the head of femur AVN is neck of femur fracture. The fracture is neck of femur. The fracture is neck of femur. AVN is head of femur. The fracture is neck of talus. AVN is body of talus. And the scaphoid, the fracture is at waist and the AVN is at proximal pole. You understand? Good. This one, yeah, we just see. OA is osteoarthritis and ON is osteonecrosis. ON, osteonecrosis is other new term for avascular necrosis. Okay, and you know head of talus will be a spad. Okay, so neck of talus is a fracture. It is not a part. So A and C and E. Calcaneum. See, what is the bone when you fall on the floor? What is the bone which first come into contact? because calcaneum is the bottommost bone in our body, that is the lowermost bone. So, even walking or simple fall, the first bone to have a contact on the floor is calcaneum, and that is the most common tarsal bone to be fractured. It is easy to remember, okay. And usually calcaneum fractures by falling from height only. No other mechanism fractures calcaneum, and directly you hit. And when you fall on the floor, if the calcaneum fractures over, if the force is minimal, it breaks the calcaneum first. If the force is more, first is breaks the calcaneum, then there will be some remaining force. It will travel through tibia, femur, it travel in the spine and exit till it gets dissipated, till it gets neutralized. It will continue to break whatever the bone which is coming in between. So, mostly it fractures first calcaneum, and if there is remaining force, that will travel and fracture the lower limb bones, particularly femur, hip joint, and it may injure the lumbar vertebra also. So, the same force will give two fractures, one calcaneum and the lumbar bone. So, if you look at the picture calcaneum, you do not know whether there is a normal bone or abnormal bone. It looks like some amoeba, shapeless one. So, you do not know whether it is a normal bone or fractured bone. So, how do you know that it is fractured? You draw lines. You draw lines, okay, two lines, one on the top and one on the posterior, and this angle is known as Bowler angle. And other angle you can draw on the anterior facet, articulating facet, that is known as Gissane angle. So, if the angle is maintained within the normal range, it means that the articular surface of the calcaneum is intact, you do not need to worry. If the angle is affected, it will go for a osteoarthritis, it is an indication of displaced fracture. What is the normal angle? Bowler angle is 20 to 40, Gissane angle is around 100, maybe 95 to 105. If the fracture happens in this region, in this angle will again lessen. So, Bowler angle will come down further, whereas Gissane angle will widen further. You understand? If you look at this picture only, you can easily remember. So, Bowler angle is 20 to 40, usually they are small, 20 to 40. If any fracture happens, this angle will become reduced further, 10, 5 like that. And normally the Gissane angle is more, 105. In fracture of calcaneum, that angle will further increase, 120, 130 like that. Okay, Gissane angle is increasing in calcaneal fracture, whereas Bowler angle will decrease in calcaneal fracture. Normal range also you should know. Bowler angle is decreased in fracture involving. What is the normal Bowler's angle? 20 to 40. It will come down, maybe 10 like that. Gissane angle, what is the normal Gissane? Gissane's crucial angle of Gissane, 95 to 100. Easily remember, you can easily remember as 100. So, if it is 100, in calcaneal fracture, it becomes more. Okay. So, Gissane angle becomes more and Bowler angle becomes less. Jones fracture. Jones fracture is fracture of the base of the fifth metatarsal. Okay. And the treatment is, sometimes you can use RIF, but usually treated with POP. There are two things you should know. Zone 1, 2, 3. Okay. Zone 1, it is an avulsion fracture. Okay. It is not a true zone fracture. Avulsion of the lateral plantar aponeurosis. Zone 2 is the fracture, true Jones fracture. This metaphyseal region. And zone 3 known as dancer's fracture. People who are dancing, no, all of a sudden you practice and you have a fracture, that is dancer's fracture. And if you are not a trained pugilist, that is boxer, you hit someone, which bone will get fractured? Fifth metacarpal neck. Neck of the fifth metacarpal is boxer's fracture. Base of the fifth metatarsal bone fracture is Jones fracture. And the fracture displacement is because of the inversion. Which muscle is inverter? Sir, huh? like this. Okay, so inversion. When you invert, which muscle is being stretched? Peroneus muscle. When you do, peroneus usually everters. When you invert, that is the muscle which is opposing it. So obviously, it is avulsion forced by peroneus muscle. Jones fracture is fracture of the base of the fifth metatarsal. True about eponymous. You can recollect and tell me what is your answer. How many options? All are options. Oh my goodness. We just now finished. Concentrate. Very good. Trimalleolar fracture is cotton fracture, not Potts fracture. Okay. This is about fractures. Now